Hi everyone, my name is Viviana Pimentel and I am in a group with Madeline Poe, Vendania Techie, and James Settles. Today we are going to be focusing on Vista Community Clinic, specifically the Gary Center, which is located in La Habra, California. The project that we are going to be focusing on is Population Health Transition Towards Value-Based Care, which is a grant-funded program through CalOptima. Here are a few facts and background of the project. CalOptima invests a record of $50 million in the safety net. So in April of 2022, CalOptima granted Vista Community Clinic a $50 million grant that is set to be distributed over the next 5 years. When we talked to Josh and did our own research in terms of what patients this grant is going to serve, it specifically said Medi-Cal patients and those who are severely medically underserved. What are the goals of this project? The goals of this project are to address healthcare disparities and social detriments of health among our most vulnerable members. And it's also set to provide healthcare in communities where there are few or no options for care or where systemic barriers to care have been created. Here is a glimpse of the most underserved areas in Orange County. Vista Community serves as a safety net for these patients. So here you can see that you have Central Santa Ana, Laguna Beach, Dana Point, Brea, and La Habra, and Fullerton. These are all medically underserved areas. Like as mentioned, Vista Community Clinic serves as a safety net for these patients. So what are the needs of the patients who visit the Gary Center? According to Josh, the program manager, there is a set of cohorts every 4 months. Every cohort is different, but the most prominent health conditions that they see are type 2 diabetes and uncontrolled high blood pressure. The cohort that they have at this very moment is one that is filled with patients who have type 2 diabetes and uncontrolled hypertension. Josh mentioned that every patient is different, but the program tries to see patients where they are and meet them where they're at. Addressing these obstacles, the project is set to work with patients when they were placed in a cohort. It's also set to improve access or coordination of care, meet with patients on a 1-month basis or as needed, and it's also used to discuss with other healthcare professionals on how to help patients address barriers. Here we are going to see some statistics. VCC provides comprehensive preventative care for prominent patients managing type 2 diabetes and high blood pressure, reflecting the commitment to diverse healthcare needs and the project. So here we can see from 2014 to 2020, high blood pressure had a prevalence and stroke death rate of almost 36.3%. And we are now going to see that diabetes also is a pretty prominent thing in Orange County with a death rate of 14.9%. We weren't able to find any recent statistics, so we went with the one of 2020. So the health promotion project objective is to reduce the prevalence of chronic health conditions and improve overall health outcomes among medically underserved communities. It's also set to increase awareness and knowledge of preventative health measures in the community to lead improved health outcomes and continuity of care. So another thing that Josh mentioned is that CalOptima granted them this money, so they are also able to lower the amount of emergency room visits that patients have and really focus on that preventative care measure. So this is one of the quotes or one of the things that Josh said. He said, "Our goal is to create a connecting web of all healthcare resources to enhance the overall health care of our patients and populations." This is the Gary Center. This is the one that is located in La Habra. And Michelle Lambert, the Chief Financial Officer, stated that it's set to advance community health and hope by providing access to premier health services and education for those who need it the most. So one of the health promotion methods that is used is identifying the target population. So when a patient visits the Gary Center, they are given an SDOH form, which is a social detriments of health form, which is then completed and given to Monica Alonso, who is the healthcare navigator. Monica runs these through the USD system, which is set to collect data. When a certain theme is found, they put those patients into a cohort. As mentioned, the cohort that they currently have right now is a cohort of patients that have type 2 diabetes and chronic high blood pressure. When the cohort is created, Josh and Monica meet with them to understand their barriers and ways to help them. The team then meets with patients with the patient's primary doctors to further understand the barriers and their current condition. The cohort is followed for 4 months or longer if needed. Another health promotion method that they use is curriculum development and implementation. Educational materials are created and given to patients. For example, Monica, which is a health navigator, creates flyers, brochures, workshops, and classes and one-on-one meetings. So when a patient has a doctor's appointment or a visit with their primary doctor, Monica goes in and just make sure that the patient is doing okay, or if there's anything else that they can help with. I know that they also have made flyers on teaching patients how to check their blood pressure or how to properly plate a nutritious plate. Josh stated in the interview that he was given another grant to purchase glucometer kits and portion control cups for patients who could not afford them. So here are some pictures of what they look like. He mentioned that these are very needed within this cohort and that they have made a huge difference. So here are the portion control cups. So patients are able to plate themselves a pretty good amount of food, but making it nutritious. And here are the glucometer kits for patients who need to check their glucose levels. A lot of patients are not able to afford these as they are very pricey. So Josh was really happy that this project was able to get another grant for them.
In addition to identifying target population and curriculum development and implementation, Vista Community Clinic uses a number of other health promotion methods to achieve their goals. This includes telehealth appointments. Some patients in the cohort work 10 to 12-hour days and sometimes cannot make in-person visits. Thus, VCC has granted these patients access to telehealth services. This has helped with increasing accessibility for patients, thus reducing ER visits and strengthening the patient-provider relationship. Josh Trujillo, the program manager, stated that reaching patients electronically and engaging in health promotion methods has changed our outcomes for the better. We talk to more patients and can see them progressing towards a better and healthier future. Additionally, VCC also utilizes community screenings, and these have been a vital part of the program. They're essential in early detection, prevention, raising awareness, and public health surveillance. VCC attends health fairs and community events in Orange County on a biweekly basis, and according to Josh, being out in the community has allowed for patients to gain the trust of the clinic. More patients seek help and ask about resources regarding their chronic condition, most prevalently seen as type 2 diabetes and chronic high blood pressure. Additionally, Vista Community Clinic utilizes motivational interviewing. Monica Alonso, the health navigator, is certified in motivational interviewing. Here are some of the ways she stated it helps the program. A patient-centered approach, engaging patients in collaborative conversations about their health. Motivational interviewing encourages active participation in decision-making and promotes autonomy, which aligns with the principles of patient-centered care. Promotion of health equity. Addressing and understanding the health disparities patients face is vital to tailoring interventions for them. For example, teaching patients how to check their glucose levels or teaching them how to plate a nutritious meal. It allows for a cultural sensitive approach that gives patients the respect to their cultural beliefs. Behavior change conversations. Monica, the health navigator, makes sure she is asking open-ended questions to learn more about the barriers these patients face. By doing so, she was able to understand that patients could not afford to buy a glucometer or groceries to make lifestyle changes, thus resulting in the Gary store, which is a grocery store for patients. Additionally, Vista Community Clinic utilizes culturally tailored approaches. VCC utilizes a number of strategies to provide health education and promotion to local communities in a manner that is engaging and culturally conscious. For example, the La Habra Collaborative, culmination of various businesses, organizations, and faith-based groups that work together in efforts to serve the La Habra community, and the La Habra Collaborative facilitates access to health and wellness resources, programs, and education. Vista Community Clinic also utilizes advocacy and engagement as a health promotion method, and they do this in an effort to advocate for minority populations and raise awareness for various conditions. Some specific examples would be VCC's involvement in the Love Your Heart movement, which was Valentine's Day heart health awareness promotion, in which they conducted no-cost blood pressure screenings and education. Additionally, VCC also engaged in Older American Month. The entirety of VCC was involved with San Diego's PACE program, which is the program for all-inclusive care for the elderly, and that resulted in the development and expansion of services provided by VCC for older demographics. Additionally, Vista Community Clinic has a number of support services, both mobile and on-site clinical support services. In looking at the mobile support services, um, it was emphasized many times that accessibility and transportation were one of the biggest barriers to care. So the mobile support services kind of work to mediate that, and they've increased accessibility to VCC services for individuals with chronic conditions, and they're deployable to multiple areas within Orange County. And then VCC also has on-site clinical support services. This includes cancer screenings and the liver clinic, which is an impactful 8 to 12-week program of Hep C treatment oriented towards intervention prior to the development of cirrhosis, liver diseases, or cancers. And of course, treatment and management of chronic diseases and disorders, which we are most prevalently seeing as type 2 diabetes and chronic high blood pressure. Additionally, VCC sees follow-up and continuative care as a health promotion method. Vista Community Clinic strives to succeed in supporting and sustaining their patients' positive health behavior changes. Due to this, VCC emphasizes the importance of follow-up. So patient portals, patients have access to their data, medical records, and finances via an online portal. And wraparound care, it's an essential component to successful behavior change, and it's equal prioritization of initial intervention and resources and education to sustain behavior changes. Additionally, Community Clinic utilizes an extensive follow-up time. Patients are followed for a duration of 4 months. After this, a new cohort of patients are treated, and care plans are reevaluated. Josh had gone on to say, once we educate them, we continue to provide them with the resources to continue to practice the behavior.
Hi everyone, my name is Vandana and I'm going to be presenting the theory that's going to be applied to our clinic here. And the model that I'm focusing on here is the IBM model, integrated behavior model. So it incorporates the theory of planned behavior, social cognitive theory, trans-theoretical model, and all of these kind of aim to provide a more comprehensive understanding of the factors that influence behavior and how they shape actions. So here I have an image here just going over the different norms, attitude, and agency. So I'll be going into more in detail later. So the application of the VCC Chronic Illness Management Project, the application aspect is more here. We see understanding population health, like predefined criteria for project expectations, identify relevant factors. So we have the project leverages the constructs of the IBM model, like how to influence like behavior, attitudes, norm, self-efficacy, and other environmental factors. They also collected metrics via the HEDIS to kind of assess the effectiveness of care, how they receive care, what their experience is. Also, identifying barriers and challenges are very crucial, like cultural barriers. Not everyone's keen towards the way that like, for example, American medicine practices are not always accepted in very many cultures. Lack of transportation, limited accessibility to specialty care. And we see there is a lot of one-on-one coaching to enhance self-efficacy and attitude, which is some of the strategies they use to overcome some of the barriers, and community outreach and education. One thing is that was important is retrospective assessment of the program, as these assessments help constant improvement and growth. So I wanted to highlight attitude. Attitude is a very crucial aspect here. Meeting the patients where they are is a very important slogan that they go by. It helps them to see how each person stands and where they stand and how they feel about a certain situation or their perspective towards a behavioral change. A lot of the factors that influence their attitudes and our, like, in general attitude is environment, optimism, and their health literacy level. And they're addressed, these limitations and issues are addressed via personal intervention, like we have goal setting. So they put so they help. So each patient has their own set of goals that they kind of try to accomplish that are more reasonable and vary from person to person. Education, depending on the patient, and support services. So the main thing is that they focus on being empathetic towards the patient's health challenges, which is very crucial, as each patient has their own set of challenges and barriers to go through, which needs to be addressed. Not everyone's the same. So it's very important to look at each person individually. Some subjective norms that are displayed in the clinic in patients is that many patients they have different health behavior beliefs, and they're based on their family and their community, or even they may have cultural practices or dietary traditions that are hard to come out of as they've grown up in it, so it makes it harder to change their diets. And lastly, medication regimes may not be very acceptable in social circles or cultural communities, as they're varied from person to person. We can see that economic stability, food, education, healthcare system, and many different factors, all these subcategories are social determinants of health, as they do impact one's ability to one's health and their well-being, as one with more money or more economic stability may have a higher health outcomes versus someone who may not have a very good economic stability, or someone who who doesn't have access to healthy options in food may have more lower health outcomes than someone who does. So it varies from person to person, their socioeconomic status and other factors. Perceived control is also seen in many patients, as there are many barriers that need to be identified and addressed so that patients could help overcome and get better, as overcome, or even address, or even just addressing them, as these steps become a barrier for them to perform the behavior and it becomes difficult for them. And some of the barriers that they face is like access to health tools like blood pressure machines, or glucometers. And this is important because they help keep your health in check as well. And patients with busy schedules may not prioritize health as their number one. It may not be their first priority. They have other things on their plate as their priority. We can see how there's the eight dimensions of patient-centered care, how all these different factors, emotional support, family and friends, like access to care, they all impact their patient-centered care, and it's important to look into these while trying to help improve behavior aspects.
We saw that self-efficacy plays an important role in promoting behavior change by giving individuals the choice to take control of their own health. VCC specifically focuses on this construct by providing incentives to support building self-efficacy among its patients. Some of the examples we saw were how they offered rewards for patients who successfully adhered or who would adhere to health recommendations, such as gift cards to grocery stores. We also saw that they would provide free trips to the Gary store for some. So basically, the Gary store was like a healthy resource for food options, and then offering discounts on medications for patients to adhere to their treatment plans. I actually found this graphic here on the right pretty interesting, and it really looks at, so it's a study that looks at how Medicaid incentives kind of relate to positive life changes. And they looked at chronic diseases and preventing them, and they strongly targeted smoking cessation and diabetes, which has like a lot of parallels to the Gary Center's focus. One of the interesting takeaways I have that was that 66% of the sample strongly agreed that the rewards actually helped them make a positive life change. And I definitely think this could be used as supporting evidence for VCC to continue incentivizing treatments to further support self-efficacy. So some of the perceived constraints. So we did examine a few, and they did range a wide number of factors that are similar to the social determinants of health that we had discussed before. Um, a survey similar to like the ones administered at VCC is visualized here on the image on the right. And it's really just looking at like barriers like cultural health belief barriers, but also like lack in transportation for patients. Um, yeah, so then some of the lack of access to care that we saw as examples were like transportation challenges to and from facilities. and then lack of appointment availability with specialist or specialty care. Some of the cultural or health beliefs were actually mentioned by Josh, just such as patients not wanting to seek help from the government or they don't believe in health education. So he emphasized how important that concept is for VCC to be understanding and also be able to meet them at like their level to be able to have a chance of improving their health literacy. So yeah, so that's pretty much our perceived constraints. VCC also supports long-term behavior change through wraparound services. Some examples include counseling, case management, and community resources, all of which allowing for more holistic care approach and engaging multiple external resources. So there were some suggestions for improvement that we had discussed, one being larger cohorts. Josh also expressed an interest in potentially growing their cohorts. But I mean, he noted that while engagement with the patients is positive, typically on like initial visits, maintaining contact and follow through can be challenging, but also resource intensive. So to really maximize the benefit, enrolling more individuals would coincide with a greater impact on the community as far as sustainable care. Yeah, so then we have patient engagement. VCC can always enhance new strategies and ways to get more patients engaged as far as getting involved with the preventative care plans. And a couple ways that we had discussed that we could do that is through ways of support networks, through family, peers, etc. But ultimately to aim to help the patients identify or develop a positive self-identity and be proactive about their own health. Some other improvements that we had seen, as one of the biggest things that kind of came up in our interview was as basically streamlining care as far as technologies go, and implementing patient portals where they can see access to their health records electronically, schedule appointments, communicate with their healthcare providers, and enhance basically all of this to allow then enhance their own self-management and efficiency. The limitation is patients currently are having to go to the clinic physically to get their information. So there is an electronic way that could be streamlined. And then one of the last improvements we were talking about was empowering stakeholders. So that includes all the people that are medical staff, like physicians, dentists, nurses, medical assistants, and even caregivers. But really just to see how they can utilize aspects of the integrated behavioral model and these constructs to ultimately improve preventative care services. And then, yeah, I think that's really just building a culture of prevention. And this is our works cited page, and that is all for our presentation. Thank you so much.